Good morning, ma'am. So today our topic is prevention for the tetralogy of Fallot. Here's the handouts, ma'am, to guide you. So our goal here, after the health teaching, the mother and significant others are expected to acquire knowledge about tetralogy of Fallot to promote health. So first, what is tetralogy of Fallot? It's a rare condition caused by a combination of four heart defects that are present at birth congenital. Infants and children with tetralogy of Fallot usually have blue skin because their blood doesn't carry enough oxygen. Tetralogy of Fallot often diagnosed during infancy or soon after. However, tetralogy of Fallot might not be detected until later in the life in some adults, depending on severity of the defects and symptoms. So signs and symptoms of tetralogy of Fallot. Symptoms vary depending on the extent of obstruction of the blood flow out of the right ventricle and into the lungs. Signs and symptoms may include bluish coloration of skin caused by blood low in oxygen, shortness of breath and rapid breathing, especially during feeding or exercise, loss of consciousness, clumping of fingers and toes, an abnormal rounded shape of the nail, poor weight gain, tiring easily during play or exercise, irritability, prolonged crying, and heart murmur. Causes of tetralogy of Fallot occurs during fetal growth when the baby's heart is developing, while factors such as poor maternal nutrition, viral illness, or genetic disorders might increase the risk of this condition. The most cases, the cause of tetralogy of Fallot is unknown. The four abnormalities that make up the tetralogy of Fallot include pulmonary valve stenosis, ventricular septal defect, or reading aorta, and right ventricle hypertrophy. Risk factors. While the exact cause of tetralogy Fallot is unknown, the various factors might increase the risk of a baby being born with this condition. The risk factors include a viral illness during pregnancy such as rubella, alcoholism during pregnancy, poor nutrition during pregnancy, a mother older than age of 40, a parent who has tetralogy of Fallot, and presence of Down syndrome or DiGeorge syndrome. So the treatment of tetralogy of Fallot requires surgery. This usually occurs within the first few months of the life. The surgery includes closing the VSD and enlarging the pulmonary valve. If the tetralogy of Fallot is left untreated, it can cause problems with the heart rhythms, developmental delays, and seizures. If the condition is never fixed, which is rare, it typically causes death by the age of 20 years old. Usually, a doctor will notice the condition early on and perform surgery to correct the problem.